Welcome to Comcare's 2023-24 Regulatory Priorities and Incident Management webinar. My name is Bev Smith. I'm the Senior Director of National Operation for Comcare's Regulatory Operations Group, and I'll be one of your hosts for today's event. Before we officially get started, I would like to acknowledge the traditional owners of the lands on which we are virtually meeting today. I'm joining you from Sydney, so I'd like to acknowledge the Gadigal people of the Eora Nations. I would like to pay my respect to their elders past and present and acknowledge the contribution they have made and continue to make. I also extend that respect to other Indigenous Australians and Torres Strait Islander people who are present. I acknowledge the cultures of everyone here today and the richness that those cultures bring to the work we do. As you would have seen from our registration invitation, we have a mix of Comcare senior leadership guiding us through today's webinar. We have the pleasure of hearing from Comcare CEO, Greg Vines. Greg will be providing an introduction shortly. We are also joined by Justin Napier, the General Manager for Regulatory Operations Group. Also joining us from Regulatory Operations Group are Kelly Heron, the Senior Director for National Programs and Enabling Teams, and Peter Davies, the Director of Regional Operations for the ACT. In today's session, Justin, Kelly and myself will focus on discussing Comcare's 2023-24 regulatory priorities. This will be followed by an informative discussion with Peter and myself on Comcare's regulatory approach to monitoring compliance of incident management systems, and we'll be providing details of the inspection program we will be running this financial year within the jurisdiction. Through the registration process, we've received some fantastic questions. Where possible, we have tried to answer these within the content of the webinar. At the end of the session, we will include a few minutes for Q&A through the Teams chat if there are any further questions related to that content. Now for some general housekeeping. It is important to note that this session is being recorded. However, only myself, the other presenters and the slides will be captured in the recording. You will notice your microphone and camera are not able to be turned on. However, we do encourage you to participate in the conversation via the chat. We do ask that you keep this chat respectful and on topic. If you're using the Microsoft Teams app, there are instructions on the screen now on how to turn off chat notifications during this webinar. In case you encounter any technical difficulties during the webinar, such as audio or video problems, please try refreshing your browser or rejoining the session. This recording and other resources will be made available on our website in the coming weeks. So, enough with the housekeeping and on to the main event, for which I have the privilege of properly introducing our CEO, Greg Vines. Please join me in extending a warm virtual welcome to Greg.
Thanks very much, Bev, and good afternoon, everyone, and many thanks for joining us today here at Comcare. I'd also like to acknowledge the traditional custodians of the land that we're meeting on today and pay my respects to their elders past and present. And I also extend that respect, of course, to all Aboriginal and Torres Strait Islander people who are here today. I've spent most of my career in the workplace relations space, and something I've focused on throughout is what I like to refer to as the dignity of work. What I mean by this is the ability of people to not only have the direct benefit of employment, but to work in an environment that's safe and productive, and most importantly, one that facilitates their physical and mental well-being. I see an essential part of Comcare's role is to work with employers to give them the tools and information they need to make this happen. And of course, to support workers to be safe and healthy at work. This is the first time we've hosted a webinar on our regulatory priorities, and I hope it gives you a better understanding of those priorities and also of our approach. Comcare sets these priorities through a risk-based and evidence-led approach. This ensures we're placing additional focus on those areas that really require it. For 2023-24, we've identified 6 priority areas. I'll leave the broader discussion of these priorities to my regulatory operations colleagues, but I'd like to outline a couple of them as they're front and centre in our current prevention efforts. And they also align with the strategic priorities for our own jurisdiction and indeed nationally. Our priorities place a significant focus on psychosocial health and safety. Although it's always been part of the primary duty of care for employers, the 2018 review of the model work health and safety laws found that this wasn't always well understood. The Australian Government has now amended the work health and safety regulations to strengthen and clarify what employers must do to manage risks for psychosocial health. These amendments came into effect on the 1st of April this year, and a code of practice to support these changes is currently being considered by government. Later in the session, you will hear about how we are working with our diverse jurisdiction to adapt to these changes, including through our regulatory approach and an important pilot inspection program, which will inform our future work in this field. Psychosocial hazards are also a significant focus of Comcare's first prevention strategy, which we released late last year. This 3-year strategy aims to provide a coordinated pathway to support workplaces to prevent harm and enable a culture of health and safety, compliance and reporting. The key to supporting workplaces is to focus on what will make the biggest impact. In our scheme, we've identified work demands, body stressing, and bullying and harassment, including workplace sexual harassment. We've chosen these prevention priorities based on our workers' comp and WHS data. Bullying and harassment, for example, is the #1 cause of psychological injury in our scheme, accounting for around 1/3 of all workers' comp claims related to mental stress. We're also focusing on body stressing, as it's consistently the highest contributor to workplace harm, more than 40% of all accepted claims in our scheme. The prevention strategy outlines what actions Comcare will take to address these priorities, and these include developing and delivering practical education, training and resources, building and using our data and intelligence so we can identify those workplaces, jobs and workers at highest risk and therefore have more targeted approaches, designing and promoting evidence-based prevention programs, projects and initiatives, and of course, working with stakeholders to have more consistent approaches to tackling key challenges. Another important focus of today's webinar is incident management. Responding effectively to incidents is essential for any employer to deliver a healthy and safe workplace. Comcare has a program where we aim to assess the incident management systems and arrangements in place for every employer in our jurisdiction, assisting them to meet their duties and obligations under the WHS Act. It's a proactive approach and a priority that aligns with the 10-year Australian Work, Health and Safety Strategy developed by Safe Work Australia and released earlier this year. This WHS strategy has been agreed to by all Australian jurisdictions, including the Commonwealth, and sets an ambitious national vision for reducing worker fatalities, injuries and illness. One of the key enablers in the WHS strategy is embedding good work, health and safety practices in all work and industries. Effective incident management as part of a robust WHS management system is at the heart of this, a vital element in preventing harm. But it's not just a set and forget prospect. These approaches need frequent review and adaptation as the work health and safety environment changes. But thanks again for joining us today. I do hope the webinar gives you a strong understanding of our regulatory priorities and approach, and fresh perspectives and practical resources to help you prevent harm and enable a culture of prevention, safety and reporting in your workplaces. I'll hand you back to Bev to begin the session, and once again, thanks very much for joining us. Thanks, Bev.
Thanks, Greg. Greg's discussion about some of our prevention efforts really highlights our aim to make workplaces safer and healthier by preventing harm. supporting early intervention, encouraging adoption and better practice guidance, and ensuring effective compliance with the Work Health and Safety legislative framework. We recognise there is a lot of discussion around Comcare's regulatory priorities and general compliance in the workplace. We can't cover everything in this webinar, but we will continue to address those topics in webinars throughout the financial year. We will also be regularly updating our website with information regarding our regulatory priorities. The regulatory priorities page on our website has gone live this morning. More detail can also be found within Comcare's prevention strategy for 2022-25, which outlines what actions are being taken to ensure our purpose to promote and enable safe and healthy work is achieved. For more information, a link to these resources will be available in the chat. I will now pass over to Justin Napier, the General Manager of the Regulatory Operations Group, to start our session about the 2023-24 regulatory priorities.
Thanks, Bev, and good afternoon, everyone. So I'm here to outline Comcare's regulatory priorities for 2023-24. In order to support and monitor safe work practices, Comcare has powers under the Work Health Safety Act, which include regulatory functions and powers for compliance and enforcement. We have various compliance tools that we can apply in different circumstances. Our preference is to work collaboratively with our PCBUs. However, in more serious cases, we will not hesitate to use enforcement powers when we consider these necessary and appropriate. Our compliance and enforcement activities are both proactive and reactive in nature. In a reactive way, we respond to notifications to evaluate whether notified incidents result from a breach of WHS duties or obligations. On the other hand, our proactive regulatory activities are intended to support and enable duty holders to meet their obligations under the WHS Act. The regulatory priorities we have identified will ensure that additional focus is placed on specific WHS risks with a prevention focus. We have identified these regulatory priorities utilising a risk-based and evidence-led approach. This includes the review and analysis of our regulatory data and a focus on the priorities within Comcare's prevention strategy and the Australian WHS Strategy 2023-33. Through our engagement and activities, we aim to assist organisations in our jurisdiction to proactively reduce the potential for harm to occur by addressing those factors that directly or indirectly contribute to that harm. For 2023-24, 6 regulatory priorities have been identified. They're on the screen now. WHS management systems, contractor management, silica, body stressing, being hit by moving objects, and psychosocial hazards. We will be focusing our proactive regulatory activities on these priorities throughout this financial year. We plan to run a series of webinars focusing on these topics, and we will continue to provide information and resources on our website. So let's dive into each of these priorities. Our first regulatory priority will be WHS management systems. This is an ongoing priority for Comcare because we know that well-implemented, effective WHS management systems are key to providing a framework to deliver improved WHS performance in an organisation. The evidence shows that effective WHS management systems can have a large-scale positive impact on the health and safety of workers within Comcare's WHS jurisdiction. And the Australian WHS Strategy 2023-2033 recognises the important role that WHS systems have in embedding good WHS practices across organisations. With this in mind, our focus this year will be on incident management systems and arrangements. Throughout the coming year, Comcare will conduct proactive inspections with organisations in our jurisdiction to assess whether incident management systems and arrangements are in place. Now, a point to note, which Kelly will speak to shortly, is that psychosocial hazards must be part of your risk assessment and management activities. Accordingly, psych hazards need to be incorporated into your incident management framework. Recent amendments were made to the work health safety laws, which came into effect in the Commonwealth jurisdiction on the 1st of April this year. Among the key recommendations was one, to amend the WHS regulations to deal with how to identify the psychosocial risks associated with psychological injury and the appropriate control measures to manage those risks. PCBUs should ensure that they are adequately capturing the psychosocial risks in accordance with the legislative changes. Bev and Peter will be discussing this program of work within the next part of this webinar, and they will explain how the program will be conducted by our inspectors and outline key considerations for your organisation. I'll now pass back to Bev to detail our next priority.
Thanks, Justin. The next regulatory priority I would like to talk about is contractor management. Comcare's work health and safety incident data continues to show a high number of notifications involve contractors, with approximately a quarter of notifiable incidents involving a contractor in 2021 and 22. The Australian Work Health and Safety Strategy also identifies complex contract management arrangements as a persistent work health and safety challenge. Contractor management will therefore continue to be a regulatory priority this financial year. We know that particular working conditions, arrangements, and personal characteristics compound work health and safety risks for workers, putting them at greater risk of work-related illness, injury, or death than others performing the same work in the same environment. Factors known to affect workers' vulnerability include working in a more complex contractual chain, for example, labour hire workers. The nature of work is also changing, along with the relationship between workers and PCBUs. Growing numbers of people now have multiple jobs, and more frequently multiple PCBUs are involved in work at the same location or involved in the same undertaking, who share responsibilities under work health and safety laws. Supply chains are also becoming more complex and globalised with more participants. While roles and responsibilities are relatively well understood in traditional work arrangements, more can still be done to explain work health and safety roles and responsibilities in these complex arrangements and consider risk more systematically. Comcare also receives a number of requests for assistance relating to contractor management, including inquiries about incident notification requirements, risk management and controls, duty of care, and consultation. So, with this in mind, we will continue our focus on contract management arrangements in the Commonwealth jurisdiction as an ongoing regulatory priority. This year, we will aim to focus on duty holders' understanding of work health and safety roles and responsibilities in a contractual chain and the effectiveness of contractor management arrangements, including how these are being monitored by PCBUs. The next regulatory priority I would like to speak about is silica, which poses another notable risk to the jurisdiction. For those who haven't come across silica before, silica is a naturally occurring mineral that can be found in rocks, soils, and sand. It is used to make a variety of products, including composite stone used to fabricate kitchen and bathroom bench tops, bricks, tiles, concrete, mortar, and some plastics. When workers cut, crush, drill, polish, saw, or grind products that contain silica, dust particles are generated that are small enough to lodge deep in the lungs. If these become airborne and are inhaled by a worker, it's extremely dangerous. And the rapid re-emergence of accelerated silicosis, particularly amongst those working with engineered stone, is a well-publicised and of significant concern. While the manufacturing of engineered stone itself is not of key concern in the Commonwealth jurisdiction, exposure to respirable crystalline silica dust generated from work activities such as construction, tunnelling, and the use of engineered stone in construction fit-outs is of significant concern. An interesting fact is that the silica content of some sandstones in Australia contain equivalent levels of silica to engineered stone, and Australia is currently building some big tunnels through that sandstone. The Australian Work Health and Safety Strategy aims to have no new cases of accelerated silicosis by 2033. Comcare will engage with relevant stakeholders and PCBUs across the jurisdiction with the aim of raising awareness of the exposure risks and working with silica-containing products to ensure that Commonwealth PCBUs consider these risks when contracting, managing or undertaking construction or tunnelling activities. Our major infrastructure projects team will also work with PCBUs in our jurisdiction where there is a known risk to ensure they have a clear understanding of the duties and workplace exposure standards, and they will be monitoring the effectiveness of control measures PCBUs have in place to eliminate or minimise the risk of exposure to respirable crystalline silica dust. With that, I'll pass over to Justin to discuss our next priority.
Thanks, Bev. So the next priority is body stressing. Comcare chose this priority because body stressing injuries have consistently remained the leading contributor to workplace harm across the Comcare scheme. 42% of all accepted Comcare injury claims in 2020-21 involved body stressing. And the leading causes for body stressing were manual handling and computer work. The continually changing nature of work and an ageing workforce brings new pressures that may see a further rise in body stressing injuries. This regulatory priority also aligns with the top priorities within our Comcare prevention strategy. Body stressing injuries are associated with repetitive and strenuous work. They commonly lead to musculoskeletal disorders and may also have negative psychosocial impacts. And this is an Australia-wide issue. In January 2023, Safe Work Australia released their report on WHS statistics, which found that body stressing accounts for 37% of all claims in Australia in the same period. So through the review of data and evidence, Comcare aims to better understand the causes of body stressing in our jurisdiction. We will identify ways to minimise these risks and, in consultation with PCBUs, share any identified best practice and initiatives. So on to our next regulatory priority, being hit by moving objects. The Australian WHS strategy highlights that being hit by moving objects is one of the most common causes of workplace injuries in Australia. It also accounts for a significant number of workplace fatalities. Comcare's incident notification data confirms that this is a common hazard across our jurisdiction. Our notification data shows that the most common types of incident categories are being trapped by moving machinery or equipment, being trapped between stationary and moving objects, and exposure to mechanical vibration. Through this priority, we will engage directly with the transport and logistics industry to raise awareness about the need for the effective implementation, review, and maintenance of traffic management plans. Our final regulatory priority is the prevention of harms associated with psychosocial hazards. I'll now pass to Kelly to provide an overview of this priority and the work of our psychosocial regulation team.
Thanks, Justin. The psychosocial hazards are aspects of work which have the potential to cause psychological or physical harm. The Australian WHS strategy lists managing psychosocial risks as a persistent WHS challenge for Australia, and there is significant work underway nationally to provide support and guidance to PCBUs in relation to preventing psychological harm. While Comcare continues to respond to psychosocial incidents and complaints in accordance with our risk-based regulatory approach, Our psychosocial regulation team will provide a specialist focus on proactive regulation and harm prevention within Comcare's jurisdiction. Prevention is the team's primary focus through targeted intelligence-driven stakeholder engagement, education and inspection programs. The team will continue to work with the Commonwealth jurisdiction to assess and facilitate compliance with legislation focusing on psychosocial hazards, engage with stakeholders to identify and review psychosocial supports and resources, and work with other Commonwealth and state and territory WHS regulators to inform consistent approaches. The team are in the process of implementing a psychosocial proactive inspection program to regulate psychosocial hazards and risk management in the Commonwealth jurisdiction. The overarching aims of the program are to understand the level of compliance across the jurisdiction with management and of psychosocial hazards and risks, improve compliance through the provision of information and advice that prepares individual PCBUs for the implementation of legislative amendments, enable and assist duty holders to achieve evidence-based management of psychosocial hazards and risks, develop an evidence base to inform priority areas for improvement in training and resources across the jurisdiction. And we also seek to support and build capability of our inspectorate to regulate psychosocial risks. Through our delivery of the pilot program, the team have noted some emerging themes as a result of the initial engagements, including some barriers and enablers to psychosocial risk reduction. While not exhaustive or conclusive, some of the initial themes include consultation arrangements, job demands, culture and identity, economic factors, procedural fairness and training, exposure to trauma, and organisational change. We plan to take these themes and prioritise guidance materials to support the jurisdiction, and these will be available on the website. We are currently evaluating the program post-pilot to incorporate lessons learned and implement identified improvements with a view to rolling out the program further in the jurisdiction. You might also be interested to know that we have developed a number of case studies based on Comcare regulatory activity in response to incidents involving psychosocial hazards and risks at workplaces in the Commonwealth jurisdiction, and these can be found on our website. I'll now hand back to Bev to wrap up the discussion on Comcare's 2023-24 regulatory priorities.
Thank you, Justin and Kelly. So to close out this discussion, I would like to draw your attention to our regulatory priorities page on our website, which holds a range of materials relating to these priorities. Throughout the year, we will continue to update this page with further information, additional resources and guidance and information on upcoming webinars. We encourage you to utilise these resources to assist in the identification of risks and harm in your workplace. If there are any additional resources you would like to see from Comcare in relation to these regulatory priorities, please let us know in the chat and we can consider these for development throughout the year. Some other key resources that will continue to be referred to during the webinar are the Work Health and Safety Act 2011, the Australian Work Health and Safety Strategy 23 to 33, and the Comcare Prevention Strategy 2022 to 25. The links to these are also in the chat. Some upcoming events to take note of are the National Safe Work Month, held annually during October to raise awareness and enable discussion about safety at work. The initiative is driven by Safe Work Australia and supported by Comcare. During this month, Comcare will deliver various engagement activities such as the Psychosocial Health and Safety Forum on the 10th of October to coincide with World Mental Health Day. Registrations will be made available in the coming months. Now on to the next part of our webinar. As Justin covered earlier, ensuring the adoption of effective work health and safety management systems is an ongoing priority for us. I will pass over to Peter, who will be presenting with me to outline our regulatory approach to ensuring PCBUs have incident management systems or arrangements in place that enable them to meet their duties and obligations under the Work Health and Safety Act.
Thanks, Bev. Excuse me. Thank you, Bev. Hello, my name's Peter Davies. It's a pleasure to be here with you today. I'm on Ngunnawal territory or Ngunnawal land. In this part of the webinar, Bev and I will provide an overview of the proactive inspection program with a view to explaining what Comcare is doing, why Comcare is doing it, what you can expect, and what you can or should do to prepare for that. As we're going through the presentation, I'd encourage you to reflect on why you think it's important to have sound workplace health and safety systems and arrangements in place. Please feel free to share your reflections in the chat as we go on. So as previously mentioned, Comcare's proactive program seeks to establish or optimise conditions for PCBUs to meet their duties and obligations under the Act. The program consists of three broad pillars. The first pillar seeks to ensure PCBUs have fundamental WHS systems or arrangements in place. The second pillar seeks to enable PCBUs in the broader jurisdiction to adapt in an effective and timely manner to significant changes in the WHS environment, such as legislative changes, and you've seen that with the psychosocial changes. The third pillar seeks to reduce harm in the jurisdiction based on analysis of data to identify significant causes of harm in the jurisdiction. And you've received a brief earlier on in the presentation about our priorities for this year. In this presentation, we will explain what we are doing in terms of the first pillar, which is ensuring PCBUs have WHS systems and arrangements in place. As part of this program of work, Comcare aims to conduct an inspection with every PCBU in the jurisdiction to ensure PCBUs have effective systems and arrangements in place to meet their duties and obligations specifically relating to the management of WHS incidents. This includes ensuring workers, including contractors and others, alert the PCBU to incidents through internal reporting, ensuring you notify Comcare in a timely manner while providing all mandated information, ensuring you complete timely and effective internal investigations or inquiries in response to incidents, ensuring effective consultation occurs with workers and other duty holders, and it also includes workers and or their representatives, ensuring you review and improve systems in response to incidents, including applying relevant changes across the organisation where relevant, and finally, ensuring the whole incident management system achieves its objectives, such as reducing the number or severity of harms. As the program progresses, we will share observations and potential better practice to enable all PCBUs to benefit from the knowledge gained from our engagements across the jurisdiction. Completion of the program will reduce harms and give us confidence in the data upon which we make our risk-based and evidence-led regulatory decisions. I'll now pass back to Bev to explain more on why Comcare is doing this.
We can't hear you, Bev.
I had to do it once. So look, thank you, Peter. As we've discussed earlier in the presentation, we know that well-implemented, effective work health and safety management systems are key to providing a framework to deliver improved work health and safety performance in an organisation and prevent harm. The importance of embedding good work health and safety practices across industries is also recognised as a key enabler to achieve the ambitious targets set out in Australia's 10-year work health and safety strategy to further reduce work-related harms and fatalities. However, as a regulator, it's not practical to review complete work health and safety management systems all at once. So we have identified critical components to focus on over the upcoming years. As we mentioned earlier, the first component we will focus on this financial year is incident management systems or arrangements. Why should incident management systems and arrangements be a focus and not another component? For this year, Comcare prioritised incident management because it is critical to both the regulator and the regulated entities. So as the regulator, Comcare seeks to use a risk-based and evidence-led approach to its regulatory activities. Without a sound understanding of the risk and harm in the jurisdiction, we don't have the data we need to inform this approach. And this can have a negative impact on all concerned because it diverts focus and resources from the areas that pose the most risk of harm. In relation to yourselves as the regulated entities, a sound incident management system will enable you to self-regulate without Comcare intervention by assisting you to identify and resolve issues as they arise, preferably before a more serious incident occurs. Additionally, it will ensure compliance with your work health and safety obligations, such as the duty to eliminate risk to health and safety. How do you do this if you don't have any data to know what the risks are and whether those risks are being effectively controlled? Secondly, the duty to notify notifiable incidents to the regulator. You are unlikely to consistently notify relevant incidents to the regulator if you don't have effective incident management procedures and relevant instructional training for this. Thirdly, it is the duty of officers of the PCBU to take reasonable steps to ensure the PCBU has appropriate processes for receiving information about incidents, hazards and risks and addressing these in a timely way. This is a positive duty. If the PCBU does not have an effective incident management system, it will be unlikely that an officer can demonstrate they have met their duty under the Work Health and Safety Act. While incident management is the focus for this year, in future years you will see programs on consultation, with a focus on consultation with HSRs and workers particularly, risk management and due diligence. However, while incident management is the focus this year, it will be necessary for inspectors to make some initial inquiry into those other areas so they get a fulsome understanding of how incident management is integrated into the work health and safety management system as a whole. So now I'll hand back to Peter to explain what you can expect during our inspections.
Thanks, Bev. I'm just checking to make sure I've got my mute off. Everyone should appreciate that engaging with every PCBU within the jurisdiction will take us some time, with engagements occurring over the 23-24 financial year. The process itself, however, is just like any other inspection, and most attendees here today should have some familiarity with that. Step one is the initial contact. We will engage at the head office level, reaching out with a phone call to coordinate the inspection. We will request a suitable contact person and arrange a mutual time for the subsequent site visit. When scheduling the inspections, we will attempt to find a time that works for both the inspector and the PCBU. Step two is the collection of relevant documentation for review. We understand that you may have several different policies and procedures, particularly if you have specialist areas that provide technical support or conduct technical inspections and investigations. For example, most PCBUs rely on human resources or HR to manage complaints about staff conduct such as bullying, which is itself a psychosocial hazard. So from this example, you can see that your incident management system involves interaction with at least one other system within your organisation, that being HR. There are, however, likely to be other systems that may also need consideration, dependent on your organisational structure, such as facilities management and plant or vehicle management. We will look to see if your policy and procedures capture all these various elements and how they collectively work together to deliver the desired outcome. Step three is the conduct of a site visit. Following the information gathering component, we will conduct a site visit to review related data and discuss application of the system. So we'll go and speak to people to gain an insight about how it's actually applied. This will include reviewing incident registers and completing a spot check of previous incidents. So we'll get some sample incidents and follow them through to see what you did or didn't do and whether that's been corrective actions have been systematically applied throughout the organisation. The site visit will include interviews with relevant people such as your WHS or HR team, so it will be dependent on your structure, HSRs, workers, contractors, and if relevant, other PCBUs with whom you share duties. For example, if you're leasing or sharing a building. Step four is the provision of an inspector report. Following the site visit, Comcare will produce an inspector report, and that will include a compliance assessment, any recommendations, and acknowledgement of any actions the PCBU has underway. As with all inspections, if there are any outstanding actions remaining at the end of the inspection process, we will schedule a verification inspection to monitor completion of those actions. As mentioned earlier, as we progress through the program, we will identify insights and examples of better practice that we can, with the approval of the relevant PCBU or PCBUs, share with others. We will also track trends and provide advice on common issues that warrant review or consideration, effectively providing you an opportunity to resolve these before our arrival or for continuous improvement if we have already visited. That's a summary of the process. I'll now hand back to Bev to talk about our approach. Bev.
Thanks, Peter. So our aim is to ensure PCBUs have suitable systems or arrangements in place to enable them to meet their duties under the Work Health and Safety Act. Now, we're seeking to achieve this outcome in the most efficient manner and where possible without the reliance on our enforcement powers. I encourage you to engage with the inspector throughout the process and proactively address any non-compliance that is identified during the inspections. We conducted trials of this program, and the findings from the trials indicated that collaborative approaches reduce the requirement for the use of inspector enforcement powers to almost zero. As I've said, our preference is to work with PCBUs collaboratively to achieve compliance. However, I wish to reinforce that these are inspections and the inspector can and will use enforcement powers where necessary. When assessing compliance with the Work Health and Safety Act, inspectors recognise that the Comcare jurisdiction is diverse, covering a wide range of organisations and industries, and that there are as many different approaches to providing systems and arrangements as there are PCBUs. Simply stated, inspectors understand there is no one size fits all. The simplest factor is the size of the PCBU. A PCBU with 10 people will have vastly different arrangements than a PCBU with tens of thousands of workers. The inspectors will be seeking to understand what is reasonable for your organisation, and this can only come from you. Again, it is important to engage with the inspector during the process. It's a valuable opportunity to discuss the current work health and safety arrangements, why these are best suited to your context, as well as any better practice recommendations. So what is the inspector assessing? I'll hand back to Pete to explain.
In the assessment process, the inspector will consider all the information provided, the observations from the site visit, and the various interviews completed. Again, as was mentioned previously, and you'll see that we keep repeating a lot of themes, and that's to in an attempt to make sure that we're hitting on the key points here today. The primary sections of the WHS Act that the inspector will consider are Section 19 and Section 27 respectively, and they relate to the provision of information, training, instruction or supervision necessary to protect people at work. Again, a lack of documented processes and clearly articulated responsibilities increases the potential for non-compliance to occur. We are seeking to proactively identify and resolve any gaps before that non-compliance occurs and therefore prevent the harm. So what happens if there is a gap and the inspector identifies a gap? Where an inspector identifies a potential gap, the inspector will seek to determine if there is evidence of this leading to a non-compliance. Unless the inspector identifies non-compliance, the inspector will simply record the observation and recommend an action to resolve it. As mentioned previously, we encourage you to actively engage with the inspector to identify a solution before the inspector finalises their report. This enables us to acknowledge your efforts and to take this into account when determining if enforcement action is warranted. We find that our jurisdiction generally has mature WHS systems and arrangements, and from previous experience, we anticipate that PCBUs will embrace the opportunity to improve their systems and resolve anomalies that may be identified during the inspections. While we do not anticipate issues with the delivery of the program, if concerns arise in relation to the conduct of the inspection, those issues should be raised respectfully with the inspector in the first instance. And then if they remain unresolved, you should raise them through the relevant regional office. But do not be surprised if we actually find some anomalies. During our trials, we commonly found at least some anomalies or opportunities for improvement. Some common issues we identified included a lack of monitoring to ensure the paper system did not remain on the shelf, but was rather in use and effective. A lack of understanding of what and how other systems such as HR support incident management. Some PCBUs were relying on other PCBUs policies and procedures. This primarily occurred within smaller government entities, where they relied on policies and procedures of larger government entities. While this is a reasonable practice, we sometimes found that the level of consultation between those two PCBUs could be improved with consequently better outcomes. Interestingly, we also made observations that we had not anticipated, and some of those were systems or arrangements based on state or territory WHS acts. If you're in the Commonwealth jurisdiction, the Commonwealth Work Health and Safety Act applies. Some PCBUs were actually unaware they were under Comcare jurisdiction, that they had a confusion between their claims arrangements and the WHS arrangements. A PCBU considered that it had no duties to and could not see any reason to be inquiring into injuries sustained by contractors within its workplace. So as you can see, we would anticipate that none of those three issues would come up, but we found them. So noting all the information we have discussed so far, what can or should you do now? The first thing I would say is do not redirect your energies away from your current risk-based WHS priorities, unless that is, you believe it is warranted. As mentioned previously, we are interested in working with you where necessary to improve the systems and arrangements in place. If you wish to prepare for the inspection, some specific questions to consider in relation to your organisation are, do you report incidents internally in a timely and effective manner to relevant areas, including whether you have information, instruction, supervision, training to facilitate this, and do you ensure that it occurs? Do you notify Comcare in a timely and effective manner, including where contractors are involved? Or if you have shared duties with other PCBUs, are there arrangements in place for that? Don't lead to confusion and delay. Do you share a common understanding of who reports internally and who reports to the regulator if you lease or otherwise share work premises with another PCBU? Do you have arrangements that ensure any work-related claim or early intervention is investigated? Do you have arrangements to ensure interim controls are in use and effective, pending implementation of an enduring or systematic response to an incident? So when you have that initial engagement or initial review or an initial incident occurs and you put interim measures in place, are you monitoring those to make sure that they are being effective and nobody else is exposed to the harm while you're conducting your investigations to develop your enduring solution? Do you have arrangements for consultation with workers and or their representatives when you are developing a response to an incident? Now, is that it? I'm sure that you wish it was, but of course not. Now, this list appears long, but you will see that many of the requirements share interdependencies, and if you're doing one, you are likely to be doing another. So further questions you may wish to consider include, do you have arrangements for responding to provisional improvement notices issued by HSRs or Comcare enforcement notices? This should include posting the notices and disputing the notices. Do you analyse incident and claims data to identify and respond to trends in your organisation? Do you have internal reporting to WHS committees, specialist areas such as HR, and the executive to facilitate awareness and oversight? Do you have arrangements to ensure that corrective actions are completed and monitored until they are considered effective? Do you have targets or measures for success of the overarching incident management system, for example, to achieve a reduction in the number or severity of injuries? And finally, do you have arrangements for reviewing relevant policies and procedures and ensuring they remain current? If you consider that you have systems and/or arrangements in place that ensure these things occur and they are effective, then you should receive no surprises from the inspection. But as I said, don't be surprised if we do find an anomaly. We can work together to resolve those. So you now know what we are doing, why we are doing it, what you can expect, and what you could do to prepare should you wish. I'll now hand back to Bev to provide you with key takeaways.
Thanks, Peter. So the key takeaways I hope you take from this session are that Comcare is looking to take a collaborative approach to improve health and safety in the jurisdiction. We'd like to be able to work with you, and that is our preference, rather than a reliance on any of our enforcement powers. To prepare for the inspections, you may consider reviewing whether your incident management system is suitably comprehensive in your organisation's context. This includes such considerations as whether all supporting subsystems are identified, and we've spoke about those, the importance of your HR systems, particularly in the psychosocial space, and whether active monitoring occurs to ensure the system is use and effective. We do find that systems are implemented, and probably the area that does tend to need more work is the review to ensure the ongoing effectiveness of that system. However, as Pete pointed out, do not let any of this preparation stop you from working on your highest work health and safety priorities. So if you do this, it'll put you in a stronger position to meet your duties and obligations under the Act and improve work health and safety in your workplace. Throughout the year, we will provide updates to the jurisdiction on any trends we may identify from the inspections to enable your organisations to implement any learnings and continuously improve your systems and arrangements. So that brings us to the end of the presentation component of our webinar.